All right then. Hello, doctor.
Hello.
So, before we begin, do we have the patient's permission to record and ask a few questions?
Yes, we have.
Ah, all right then.
Yeah.
Could you tell me the name of our patient?
So Sakina ana dan ƙara miki tambaya ko? Me sunan ki wai? So her name is Sakina Gambo and she's very happy to meet you.
It's a pleasure to meet you as well.
Yeah.
May I ask for the patient's age?
Shekaran ki nawa ne? So she's 22 years old.
All right then. Is the pa- does the patient live in a rural or urban area?
So a ina kike zama? A cikin garin nan ne? All right. So she lives here in Bauchi town, which is an urban area.
Uh, and what is her occupation?
So aikin me kike? Hmm? All right. So she works as a tailor.
Mm, uh, okay then. Is our patient married?
Kina da aure ne? Yara fa. All right. So she's married. She has 5 children.
Okay. Okay. So about her five children, what are their ages?
So yaran naki ya shekarun su yake guda biyar din? Su shekaran su nawa? Sai sauran fa. Su ne kanana? Shi shekaran shi nawa? Sai mai biyun yan biyun. Sai ɗayan fa. All right. Watan shi nawa? So the smallest one she just delivered 2 weeks ago, and then two of them are twins. They are 5 years old. So the other two are seven. The other two are 7 and 9 years old.
Very large family.
Yeah.
So what brings her here today?
So me yasa kika zo asibiti? Me yake damun ki? Me ke ji? Kina jin me zazzabi ko me? Da me kuma? Da me kuma? All right. So she came to the hospital because she's having fever, headache, and body weakness.
May I ask a bit more about this fever? Has it been constant or has it been one day extremely hot and then another day not as hot?
So zazzabin nan yake miki ne kullum yake yi ne ko kuma yana zuwa ya tafi ne? Amma all right. She said she used to have this fever every day, but it comes and go. So it's an intermittent fever.
And about her weakness, does she have any muscle pains?
So yeah, so kina jin mutuwan jiki ne? Kina jin ciwo a jikinki gaba ɗaya? All right. Yes, she have pains in all her muscles, all over her body. So she has pains and weakness.
Very sorry to hear that.
All right.
For her headache, is it mostly hurting in the front of her head or to the side?
So ciwon kanki din nan ta wajen ina ne yake yi? Kai din fa? Kai din ta goshi ko ta gefe ko duka kai din? All right. She said the headache is generalized all over the head.
Have any of her family members, her children, or her husband reported any similar symptoms?
So, ko ke ko mijinki ko sauran yaranki akwai wani mai irin wannan zazzabi? Alright. Amma ta warke yanzu? Alright. She said there is one of her daughter. She's also having fever.
Uh, Has the daughter's fever been intermittent like our patients?
So ita ma zazzabin nata irin naki ne? Ya zo ya tafi? Alright. She said yes. She said yes. It's intermittent, just like her own.
Eh, And I'd like to ask if she's had any trouble with eating, any loss of appetite.
Alright. Kina cin abincin ki ya dan ragu ne ko kina jin bakin ki daci ba kya son cin abinci? Alright. She said her eating has actually reduced significantly, and so she has loss of appetite since beginning of the symptoms.
Mm. Has she traveled before today?
So kin yi tafiya ne kwanan nan zuwa wani waje hakan nan? Alright. So she has no history of travel to anywhere.
Uh, okay then. So we have an intermittent fever, generalized headache, weakness, and muscle pains. How long have these symptoms been occurring?
Yanzu kwana nawa ne rashin lafiyar nan naki ya fara? Kwana nawa? Alright. So she said she's been having these symptoms for 9 days now.
Mm. Can you ask our patient about her home life and
Yeah.
essentially what she eats at home?
Alright. So tana so ta ɗan san kaɗan game da yanayin zamantakewan ki na gida kamar irin su wane irin abinci kike ci, su wane irin aiki kike a gida da sauransu. Su me da me da me. Za ki iya ɗan bada misali ko biyu? Okay. All right. So her diet at home is predominantly carbohydrate based.
Mm.
Yeah.
Okay. Has our patient been experiencing any chills, feelings of coldness, shivers?
So jikinki kina jin irin sanyi jikinki yana karkarwa haka na zazzabi. All right. So she used to have chills
Have these
and
chills
cold
stopped?
also.
Ah, have these
Yeah.
chills stopped or are they continuing?
Har yanzu akwai ko kuma ya daina? All right. She said it's still happening. She's still feeling the chills.
I'm sorry to hear that.
All right.
For for her fever, what was her most recent temperature?
So her most recent temperature taken was 38 degrees Celsius.
Pretty high for a fever.
Yeah.
Eh, And has a full blood count been run on our patient?
Yes, actually, and the hemoglobin shows 11 grams per DL on this patient.
My di- so I believe for my diagnosis, I I'll diagnose. Please correct me if I'm saying this right. Zakia?
Me sunan
Am I?
naki?
So
Sakina.
Zakina.
Saki.
Yeah.
Sakina.
Sakina. I'm sorry.
Yeah. Yeah.
Pardon me. I would
Yeah, no problem.
diagnose Sakina with a complicated case of malaria, the complication being anemia, or
All
rather,
right.
mild anemia. And for
Okay.
treatment, I see that she's already hooked up to an IV. I would continue
Uh-huh.
intravenous artesunate
Or
for her malaria, and for her anemia, I suggest to increase her diet intake, increase her intake of leafy green vegetables, and
right? That's
just
good.
to
Go
raise
ahead.
that.
Well, that's good. You are doing well. So, any other thing you want to add?
I would
Future
like to ask.
prevention or something?
I, I'd like to ask one more thing. Has be, Psychina? I'm sorry.
Yeah.
I'm terrible
Yeah,
at
you are
pronouncing.
right. Sakina, go ahead, please.
Psyche,
Yeah.
Psychina. Has she
Yeah.
been experiencing any sore throat or nasal congestion?
All right. Kina jin kaman hancin ki yana toshewa ne ko makogoron ki yana ciwo? Amma babu matsalan numfashi ko hancin ki yana toshewa? All right. So she doesn't have any. So she says she doesn't have symptoms of nasal blockage or any respiratory difficulties.
Uh, all right then. I believe the treatments I've suggested for now of intravenous artesunate and an increased intake of leafy vegetables and iron-rich foods should
All right.
suffice.
So anything you want to suggest for future prevention
Ye-
of malaria?
Yeah, yes.
Go ahead, please.
For future prevention of malaria, I suggest the patient sleep with insecticide treated mosquito nets, and
Right.
also
That's good.
for for their anemia, just to also be aware of adequate nutrition, and perhaps not limit the amount of carbohydrates, because while
Okay.
carbohydrates can give energy, they're not meant for continuous consumption.
All right. You have done well. The diagnosis was correct. From the symptoms, you are able to suspect that she might be having malaria with anemia, and you went ahead to suggest the correct investigation, which is rapid diagnostic test for this patient, which revealed that she has malaria, and also you try to rule out anemia because malaria usually comes complicated with anemia, and the patient has moderate anemia. So what you did was good, and you were excellent. So the treatment also, because malaria is complicated by anemia, so it's a complicated malaria. You went ahead to treat using the IV medication, which is correct. Also, for the anemia, since it's a moderate anemia, not very severe, so dietary modifications, green vegetables, and other dietary modification would actually help this patient. So you also went ahead to suggest future means of prevention of malaria, long pants, long sleeve shirts, and mosquito netting. So you did the correct thing. So congratulations, you have done well.
Thank you, doctor. And if I
Yeah,
could
well,
ask one favor,
all right.
please tell Sagnia that I hope she recovers fully.
All right. So ta ce tana miki fatan Allah ya baki lafiya ko? So she said she's very grateful that you are welcome, and she's very grateful for what you guys have done to her, helping her out, and she's very happy.
Thank you, doctor.
So congratulations once more.